My wife and I, Amy, have been married for 26 years now and counting. Blake and Dew are 5 years apart.
As a family, we did have so much fun, and we spent a lot of time skiing. We're big sports fans. We're either watching them play a sport or we're at a sporting event.
Having good grades, being in a couple of sports, having success in those sports, winning the state championships, that was normal for us. That was what we did. And then everything's changed.
In second grade, I was diagnosed with dyslexia, and from there is where my deep anxiety issues came from.
As time went on, he was diagnosed bipolar.
When I can get a little manic or even hyper-focused, I really see that come out in like my artwork and stuff, but it can also come out in depression, where you just sit in your bed for a couple weeks at a time, just not wanting to do anything. And so I didn't want to feel like that. I wanted to do anything to make me feel happy. I started smoking marijuana when I was 12 years old. I started doing other substances about sophomore year.
He was really trying to self-medicate, and he actually did it for a while. But you know, the second you can't get one of those drugs, everything just spins out of control.
About 90% of people with bipolar disorder also have an addiction, and so then people end up having two problems, not just one, and it can spiral downhill from there. The sooner we treat mental health symptoms, the better outcome we're going to have.
We have a really ambitious agenda. We want to make sure that every kid in Colorado benefits from good mental health. We want to make sure that families get the care they're entitled to. We want to make sure there are enough facilities and services to meet the needs of all the Coloradans who require that kind of care, whether it's inpatient or outpatient care. We've heard from families all across the state who tell us they're paying for insurance, but they can't get the care they're paying for. It's awfully frustrating, infuriating actually, if you're a family in these circumstances, to watch a loved one suffer and struggle.
When Blake had his drug overdose, he was 17. We took him to 5 emergency rooms. All of them said, "We don't detox adolescents."
Who does that? How's that system working for anybody?
I said, "I'm not leaving. So figure it out." Because I've been to 4 other hospitals, and we're not going anywhere. If they had turned him away and I had accepted that, I don't know where he'd be.
I couldn't help my child, and that was a tough one. There's got to be someone that can give you a how-to for guys like me who, when it hits, go, "Hey, I got to go figure this out. Where's the place to go? Who do you call? How do you navigate insurance?"
What's great about Mental Health Colorado is they're advocating for me, they're advocating for other people that are in this situation. I really appreciate what they're doing.
We're not going to declare victory until all of us get the mental health care we need.
It took a while to find good doctors, and I got a good team in place. It's been a good process ever since.
Feels good to be getting back into society, you know.
This being my first year in college has been a great accomplishment for me, especially, you know, looking back at some of the places I was in. It's really cool to see how far I've come, and it makes me proud of myself. I do feel good now. I'm still an anxious person, you know, always have been, but for the main part, I'm just generally happy, you know. I'm not worried, I'm not scared anymore, I'm just excited. Each day I wake up just ready to do another day.